What's going on, Chattanooga? It's your girl, Sign of K here with Brewer Media Group. I have the lovely Dr. Panda here. She is the Dean of Morehouse School of Medicine. Now, speaking to me regarding the More in Common Alliance partnership that is between Morehouse School of Medicine and Common Spirit here in Chattanooga. How are you doing?
I'm doing well. How are you doing? Thank you for
I,
having me.
you're welcome. I love talking to you. I tried to track you down last year. I don't know if you remember, but that was me at the, yes, at the
Yes.
health fair, and here we are again. Tell me more about all the changes that you've seen in the program since then.
Yeah, it's been a wonderful journey, a little over a year. It
Mm-hmm.
has been very busy with a lot of progress. Grateful for my team. So, as you
Mm-hmm.
know, the More in Common Alliance is a partnership, as you mentioned, between CommonSpirit Health and Morehouse School of Medicine.
Mm-hmm.
And we are here in Chattanooga to establish a regional medical campus, and I am the regional dean for that. And I'm really grateful to Mark Harvey, who serves as our program manager, and Miss Summer Elliott, who is our senior admin assistant. So, our focus is really twofold. And while we are at Common Spirit Health and have been amazingly supported and so grateful for their partnership, the mission and vision is really to make sure that we are providing education and clinical care that is focused on health care, which
Mm-hmm.
is more right from preventive care to
Mm-hmm.
management of health, rather than just what I like to contrast it with sick care.
Mm-hmm.
So we want
Mm-hmm.
to give health care to the people as they are living their daily lives. And we are looking at really developing the workforce focused on this healthcare.
Mm-hmm.
So, a regional medical campus is where you train medical students, but our
Yes.
work is actually even before that. We are intentionally focused on pathways and pipelines. So, the mission is to build structured pathways and resources for learners who are interested in healthcare that come from communities that are underrepresented,
Mm-hmm.
economically disadvantaged, rural. As we know, Tennessee is one of the states that has the most rural hospital closings. So, how do we really provide care
Yes.
to those areas? So, recruiting learners from there, and of course, those who are minoritized. How do we work with them right from their school levels
Mm-hmm.
through college, through undergraduate, and then help them achieve their dream? And whether that is in healthcare as physicians, allied health
Yes.
professionals, nurses, or even the other vital members of the health force, like technicians,
Mm-hmm.
phlebotomists,
Mm-hmm.
physical therapists, occupational therapists. So we are working with schools like Howard High School, Tyner High School, Brainerd,
Mm-hmm.
Hickson High, and meeting with the students regularly and educating them and giving them an experience of what it is to be in healthcare, because as they say, you can't be it if you don't see it,
That's
right?
true. That's true.
And so and then what we do is that if they want to do nursing, health administration, allied health, or become physicians, we work with them. We hope they will go to Morehouse School of Medicine because
Mm-hmm.
that's where they offer those trainings, but they can go anywhere. We are not really, we just want them to achieve their dream.
Yes, yes,
And
yes.
then provide them training, clinical training here in Chattanooga. So we are working, of course, with Common Spirit Memorial, but we have
Mm-hmm.
great community partners like Dr. Hubbard and Dr. Shaw from pediatrics, Dr. Mans, Dr. Gibson from neurology. We are working with LifeSpring Pediatrics, HCA. So it is really focused on the community of Chattanooga. We are located in zip codes where we have three large healthcare systems.
Mm-hmm,
We have
mm-hmm,
a lot of
mm-hmm.
healthcare disparities.
Yeah.
So
So
yeah.
being that you did touch on some of the things that set you guys apart from other educational programs in this field. What impact are you hoping to see from the program in the community?
So, we are really intentional about engaging our medical students that are currently at
Hmm.
in Chattanooga with the community. So so the high school students actually hear from our students. So
Okay.
we like with Howard High, we are going once a month and we do what is called the Tiger Talks with their high school students. So we talk to them a little bit about what it means to be a healthcare professional, but it is a safe, informal setting where the students feel empowered to
Hmm.
ask medical students who are closer to their age. I can speak to them till I'm blue in my face, but it is
Hmm.
medical students who would really tell them what it is like, the PA students, the nursing students. So that's one way, and then they can become mentors for these students.
Yes.
In addition, our students are working with the pre-med group at UTC. Then we do community service activities, for example, health fairs.
Mm.
Last year, we had a great showing at the Minority Health Fair, which now is the Wellness Expo, and we're going to be coming back again in August. We had a whole team come from Morehouse School of Medicine, and in 4 hours, they did over 80
Oh,
healthcare
so
screenings.
good.
So we are really engaging our students in the community so that they realize what this community is, but the community realizes, and we hope that the students will train and then they'll come back here and
Yes.
stay in Chattanooga.
Now, I do like the fact that regardless of where they choose to go, you're not forcing them to stay here. You're still giving them the gems that they can take anywhere to learn because some places are like, no, I'm not giving you no information unless you're going to come here. So I
Exactly.
do like that because they can also still learn from where they're at, especially if they're uncertain. They still have some things to take with them.
Absolutely. And you know, the common spirit is nationwide. So Morehouse School of Medicine is nationwide. We have
Mm,
campuses on the West Coast, in the Pacific Northwest, in California. We have campuses in Albany, Georgia, Columbus, Georgia, Chattanooga. So a student can decide to do 2 months here, then they can go to the Pacific Northwest. So our aim is to see our students achieve their dream and they thrive, irrespective of where they train.
Now, being that you come across so many students, aspiring physicians, what are some of their concerns as far as learning or when they're first getting into the program? Because you know that's new, that's big, that's scary. So, what concerns do they have, or what are some issues that they might struggle with along the way that they come to you with?
Yeah, so they are both related to the medical training and then
Mm-hmm.
personal problems. You
Mm-hmm.
know, so Morehouse School of Medicine is really intentional to address both those. So, for example, on the professional side, they have a whole department that is dedicated to working one on one with students, understanding their learning styles, making sure that they are able to grasp. Because oftentimes, coming into medical school and learning is like learning a whole new language
Mm-hmm.
on steroids. I mean, it is very quick.
Mm-hmm.
So they have that one on one mentorship, both from education specialists and from physicians and mentors and educators. In addition, it's stressful. It's a whole different way. So there is a whole section and a department that is really focused on their well being and making sure they're thriving and that the basic needs are met. And what I'm
Mm-hmm.
talking about basic needs, food, uh, they get a financial planner right from day one who can
Mm-hmm.
help them. Because financial debt is a big stressor for all medical students. And they offer a lot of support and resources and scholarships
Yeah.
for that reason. So that's on the personal level and professional level.
Mm-hmm.
The other way is regular check ins. So it's a family. I always
Mm-hmm.
think of it, you know, we are a family. And while we have a large number of students, we have divided them into small learning communities. So there
Mm-hmm.
is a small group of students with physicians and support people who are really coaching them.
Yes. Now, before you even said family, I was in my head, I was like, you're kind of like a mother to all, like you're over, all these students. And with that, everyone's coming from a different background. They view things differently, they learn differently, but they also possess certain things within them that stand out. So, what qualities do you guys look for in those students that you feel make them exceptional in the program and will make them a wonderful physician as they leave?
Yeah. So, there is, you're absolutely right. We look at the whole person. And we're actually focused on whole person education. And what we mean by that is we want to make sure that we are caring for the whole patient, not
Mhm.
just the disease they come with, like diabetes or
Mhm.
hypertension, but who has the disease? What are the patient's social support? What are their needs? But we can only allow our students and ourselves to do that if we care for the student that way, right? So we want to make sure that we are looking for students who have that passion for whole
Mm.
care, that they understand. So compassion, empathy is something that is very important. And then they have realistic understanding of what they're getting into because it's
Okay.
not easy. They're going to commit a long period of their lives,
Mhm.
money, and sacrifices. So they understand that. In addition, that they are well rounded. True, we need a basic baseline knowledge that is needed, which they are standardized tests and other things that the uh, national organizations have said. But in addition, we are really, we have students with multiple diverse talents and skills. And there are
Mhm.
opportunities at Morehouse School of Medicine to make sure that these students continue those talents. Because many times, we have students who are musicians, students who are dancers, and then they come
Mhm.
into medical school and they have no time for that, or that is not recognized. They have this feeling that we are going to only be doing studies. While that is important, but how can we find time to give us experience what gives us joy and have
Yeah.
it around build those opportunities within the work and study time also. So we are looking for students who are understand but who are compassionate, and as I mentioned, students who have had oftentimes lived experiences.
Now, Dr. Penny, you hit it right on the nose. As before you even got into the part about the students who may have had other interests such as dance or music, I was like, what would you tell someone like myself who majored in communications, interested in theater, but wants to switch over? So that lets me know all that I would need to know if I wanted to learn and switch over. Like, we're not only going to just do A, B, C, and D. It's probably going to be the whole alphabet, and you need to be sure and certain that this is what you want to do. So thank you for answering that. Now, my last question is: when people hear Morehouse School of Medicine, Chattanooga, what do you hope that name represents?
I think what that I would like to bring forth the mission of what Morehouse School of Medicine is, because that is what remains very central to who we are, how we operate, and what we remind ourselves, especially when things feel really challenging, right?
Mm-hmm.
And the mission of Morehouse School of Medicine is leading the creation and advancement of health equity to achieve health justice. So I'm going to again say that it's leading the creation and advancement of health equity to achieve health justice. And what is health equity for one person may be different. So when I talk about that holistic individual care is, and I won't be able to say it as well as our President CEO, Dr.
Mm-hmm.
Valerie Montgomery Rice, reminds us all the time, but I'm going to try to paraphrase what she says, is making sure that every person gets the health care they need when they need it, how much they need it, and
Okay.
really catering it. So I hope what when people in Chattanooga hear about Morehouse School of Medicine, we've got great healthcare systems in
Mm-hmm.
Chattanooga. We have UTE and Erlanger, we've got Common Spirit Memorial, we've got HCA Parkridge. Great giants, and we are grateful for everything. But how can we come together, not as competitors, but as collaborators around
Hmm.
a common shared covenant mission of how can we improve and advance the health in the Chattanooga community together while lifting our community and future healthcare workforce to achieve their dreams.
No, that is an award-winning response. I love that. No, I really love the part where you said we're not competitors, even though there's so many giants. We're all, the mission should be the same, and that is to serve the community in every kind of way and make sure that every person with that healthcare need gets it addressed. So I thank you so much. Thank you, thank you, thank you. Hopefully, this goes on to help aspiring physicians in our area as they come across this because what you said is so inspirational and it's amazing. It makes me want to go into this field. So I thank you so much, Dr. Panda. You guys will have more information up on our website, power94.com, regarding this conversation as well as more about the More in Common Alliance program and how you can join if interested. All right. All right. It's your girl, Zainab K for Brew Media Group. Thank you so much again, Dr. Panda. Have a
Thank you.
wonderful day.
Thank you for the time.